Good evening, class. To continue with our discussion about mental health disorders of the elderly or geriatric population, this week we will discuss depression in this population. For the purpose of this lecture, the terms elderly, geriatric, and older adults will be used interchangeably. These terms all refer to people over 65 years of age. According to the CDC, depression is the most prevalent mental health problem among older adults. Depression in older adults is often overlooked or waved away, but according to the American Psychological Association, in 2012, depression affected 15 to 20% of all older Americans. At the end of this lecture, you will be able to name 5 signs and symptoms of geriatric depression, name 3 out of 5 causes and/or risk factors for geriatric depression, and name 3 out of 5 treatment modalities for geriatric depression. Now we're going to talk about what is depression. Depression is a medical condition that interferes with daily life. It is associated with distress and suffering. It is not a normal part of aging, a sign of weakness, or a character flaw. It can lead to impairments in physical, mental, and social functioning. Many older adults with depression need treatment in order to feel better. There are several types of depression, but the most common types of depression are major depression, which are severe symptoms that interfere with your ability to work, sleep, concentrate, eat, and enjoy life. Persistent depressive disorder, dysthymia, depression symptoms that are less severe than those of major depression but last a long time, at least for 2 years. And minor depression, that's depression symptoms that are less severe than those of major depression and dysthymia, and symptoms that do not last long. Also to note, in major depression, some may experience only one episode in a lifetime, but more often a person may experience multiple episodes. Now, depression has many symptoms, including some physical ones. But if a person experiences several of the following symptoms for at least 2 weeks or more, they may be suffering from depression. Some signs and symptoms include persistent sad, anxious, or empty mood, loss of interest or pleasure in hobbies and activities, feelings of hopelessness and pessimism, feelings of guilt, worthlessness, and helplessness, decreased energy, fatigue, being slowed down, difficulty concentrating, remembering, making decisions, difficulty sleeping, early morning awakening or oversleeping, appetite and/or unintended weight changes, thoughts of death or suicide, and even suicide attempts, restlessness, irritability, aches or pains, headaches, cramps, or digestive problems without a clear physical cause and/or do not ease even with treatment. Now, most cases of depression are diagnosed in young adults, but depression can occur at any age. Older adults are at a higher risk for developing depression if they are female, and females being because they are more at risk because they have more chronic health conditions than males. If you have a chronic medical illness such as cancer, diabetes, or heart disease, have a disability, sleep poorly, are lonely, or socially isolated. Now, some other risk factors for depression can include a personal or family history of depression, the use of certain medications, you suffer from a brain disease, misuse of alcohol or drugs, have experienced stressful life events such as a loss of a spouse, divorce, or taking care of someone with a chronic illness. Remember, grief after loss of a loved one is normal and usually does not require treatment. However, grief that lasts a very long time or is usually severe following a loss may require treatment. Now, there are treatment options for depression. The primary treatment options for depression includes medication and psychotherapy. The doctors and therapists usually develop a personalized treatment plan for each person, and different treatments or treatment combinations may have to be tried before the right one is found for an individual. Medications like antidepressants work well for depression and are usually the first choice of drug. Depressive symptoms may improve in a week or two, but they can sometimes take up to several weeks to work fully. Some antidepressants are Lexapro, Prozac, Paxil, Effixor, or Zoloft. Some medication risk factors that must be considered if an older adult starts an antidepressant. One such risk factor is older adults have to be especially careful when taking medications for different conditions, as the medications can easily get mixed up. Another risk factor that needs to be considered is older adults have a higher risk for experiencing bad drug interactions, missing doses, or overdosing, especially if their doctor is not aware of all the medications that they are taking. Another risk factor to take into consideration is that older adults are more sensitive to medications, therefore they may require a lower or less frequent dose. One of the main things to remember is that before starting a new medication, older adults and family members should check with the doctor about whether a medication can affect alertness, memory, or coordination to help ensure that the new medication does not increase the risk for that patient to fall or that older adult to fall. Another treatment option for depression is called psychotherapy, which is our talk therapy. Psychotherapy helps by teaching an individual new ways of thinking and behaving and changing the habits that may contribute to the depression. Research shows that cognitive behavioral therapy, or CBT, including a version called problem-solving therapy, may be an especially useful type of psychotherapy for treating older adults and improving their quality of life. Research has shown that for older adults, psychotherapy is just as likely to be an effective first treatment for depression as taking an antidepressant. Some older adults prefer to get counseling or psychotherapy for depression rather than adding one more medication to the other medications they are already taking for other conditions. Another treatment modality for depression is electroconvulsive therapy. This is sometimes used for severe depression that is unresponsive to medications or psychotherapy. It is used as a last resort for severe depression. Severe depression occurs when a person is unable to eat or they develop false fixed beliefs or delusions about their illness. ECT is a type of brain stimulation therapy that involves activating the brain directly with electricity, magnets, or implants to induce a seizure. The seizure activity is what helps to lessen the effects of depression. Therapists do not know why ECT treats depression, but research has shown that depressed patients often feel better after 2 to 3 sessions. ECT treatments usually consist of 10 to 12 treatments, 2 to 3 times a week at varied intervals. ECT has been around for almost 80 years and remains the strongest and fastest acting treatment for severe depression. Research has shown that ECT is very effective in treating severe depression in the older adult. Despite its effectiveness and safety record in older adults, many misconceptions still persist among patients and healthcare professionals. Side effects of ECT include confusion and memory loss, which are usually short-term but can sometimes linger. Another treatment modality for depression includes our complementary therapies. Some complementary therapies for depression include yoga, exercise, and certain dietary supplements. These therapies may offer some benefits for people with depression. However, they should not replace talking with a healthcare professional or continuing with a treatment plan that is already in place. Beyond treatment, there are other things an individual can do to help overcome their depression. First, as you begin to feel better with treatment, you can gradually start to do the things you used to enjoy before you had depression. Studies have shown that doing these things, even when you don't expect to enjoy them, can help to lift your spirits. Next, you can break up large tasks into small ones and do what you can. Don't try to do too many things at once. Next, spend time with other people and talk to a friend or relative about your feelings. Remember, you need to stick with your treatment plan because it will take time for treatment to work. And lastly, discuss decisions with others who know you well. Don't make important life decisions until you start to feel better. In conclusion, I'd like to say that depression is the most prevalent mental health problem among older adults. Depressive disorders are a widely unrecognized condition and are often untreated or undertreated among older adults. If diagnosed early, depression is one of the most successfully treated illnesses among our older adults.